Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera Dr. NORHASLINDA. My name is Nurul Adila binti Muhammad Fadzilah and my matrix number is 199062. I'm from Bachelor of Science with Education, major Statistics. I will begin my presentation now. For this individual assignment 1, I choose a research paper about the relationship between diabetes mellitus and COVID-19 prognosis, a retrospective cohort study in Wuhan, China. So, this is the print screen of this article in Easy Access UPM. I get this article in database Science Direct. Okay, next. This is the list name of authors and their affiliation. On my left hand side is the list name of authors, which is there are 10 authors altogether for this research paper. And on my right hand side is their affiliation. All of them is from Wuhan, China. Okay, other information that I can retrieve for this research paper is first one is the number of cited papers, which is 4. This number is quite small since this research paper is new and published in this year 2020. Since this COVID-19 also is a new issue, so that's why this paper is quite new to publish. And next is total of paper, which is 25. A total of papers, book, thesis, and other publication in the bibliography is 25. I get this total of number at the end of this research paper. Okay, next is, okay, this big number is number of deaths in the worldwide because of COVID-19, which is 1,281,309 people died because of COVID-19. So this is the issue that we need to focus. And there is 300 people died in Malaysia because of COVID-19, and I found an interesting fact in Google, which is 70% of Malaysia's coronavirus fatalities had diabetes. This means that 7 out of 10 people who died to COVID-19 in Malaysia suffered from diabetes. And this research was conducted by Institute for Clinical Research, which is ICR. Okay, for the introduction, I will explain a little bit about the two important things in this research paper. The first one is coronavirus and the second one is diabetes mellitus. So coronavirus disease 2019, or famously commonly known as COVID-19, is an emerging infectious disease that first appeared in Wuhan, China, and quickly spread throughout the world. So to confirm this COVID-19 infection, frontliner or nurse and doctor will throat swab sample were collected from the upper respiratory tract of all the patient and tested. The people that tested positive will be quarantined in the hospital. Next is diabetes mellitus. So this diabetes mellitus, or commonly known as diabetes in Malaysia, is a metabolic disease that causes high blood sugar. So next, the number of patients that involved in this research is 584 patients. Among these 584 patients, there is 500 of non-diabetes patients and 84 is diabetes patients. And for subgroup, among 84 diabetes patients, there is 29 insulin required patients and 55 non-insulin required patients. Next, I will talk about the timeline of this research, which is they collect or taken their patients for their COVID-19 patients from 25 December 2019, as you can see, until 20 March 2020. And all of these data and patients were taken from Wuhan number 7 hospital. Okay, next we move to the objective of this research paper. So there are a few objectives in this research paper, but the main research is about diabetes mellitus, which is they want to study to understand the relationship between diabetes mellitus and the prognosis of COVID-19. They want to see if this diabetes mellitus is give an effect to the prognosis of COVID-19. In addition, they also want to study if this diabetes is an independent risk factor for the prognosis of COVID-19. Next, we move to insulin. So for insulin, they want to study the overall survival time on subgroup analysis in diabetes patient. Last but not least is aging. They also want to study the relationship between aging and COVID-19. Okay. For the next slide, for this slide, which is method used in the research. So there are three main methods used in this research. Three statistical method used in this research is, first is Kaplan-Meier. So for this Kaplan-Meier, they use Kaplan-Meier curve to see the survival rate between two groups. For example, non-diabetes and diabetes, non-insulin and insulin required. For example, like that. So I do a research about what is Kaplan-Meier. So basically, Kaplan-Meier is a curve that widely used in clinical and fundamental research. It is a non-parametric statistical parametric statistic used to estimate the survival function from lifetime data. And it is usually compared to group in a study, same in a two group of study. And second method is multivariate cohort analysis. So for this multivariate cohort analysis, it is also commonly used for analyzing survival time data in medical research. And the last method, statistical method, is the log rank test. So for this log rank test, this test provides a statistical comparison of two groups, same as the Kaplan-Meier. So these three methods are commonly used in the survival research field. Okay, next we can move to the results and conclusion that they get using all the method before, all the statistical method before. we go one by one. So the first one is Diebetes Mellitus. So we flashback to the previous slide, which is this Diebetes Mellitus. They want to study or to understand the relationship between Diebetes Mellitus and the prognosis of COVID-19. At my left hand side, we can see, which is figure 2, the Kaplan-Meier survival curve of the patients with and without diabetes. From the label, we can know that the red line represents diabetes and the blue line represents non-diabetes. We can see that the red line is significantly lower than the blue line. So this curve, this Kaplan-Meier curve, indicate that diabetic patient had a significantly lower overall survival rate than non-diabetic patient. From this graph, we translate from this graph. Next, they also do multivariate COG, and the data show that diabetes was an independent prognosis factor for mortality in COVID-19 patients. Next, we move to our second objective, which is insulin. The objective is to study overall survival time on subgroup analysis in diabetic patient, which is they study about an insulin required patient and non-insulin required patient. So, as we can see at the left hand side, which is figure 3, which is Kaplan-Meier survival curve of diabetic patient who needed and did not need insulin. So we can see from the label that the red line represent insulin required and the blue line represent non-insulin required. So we can see that the red line is lower than the blue line. So this graph, this curve indicate that insulin required patient had a significantly lower overall survival rate than non-insulin required diabetic patient. So we can conclude that hospital need to pay attention more to the insulin required patient. Okay, lastly is aging. So for aging, the objective is to study the relationship between aging and COVID-19. So on figure 4, which is Kaplan-Meier survival curve of COVID-19 patients over 65 years and under 65 years. So from the label, we can see that the red line represent age over 65 and the blue line represent age under 65. So we can see that the red line is significantly lower than the blue line. So this curve or graph indicate that patient older than 65 years had a significantly lower overall survival rate than patients younger than 65 years. So before that, I want to mention that all the graph and figure I get from this research paper. Okay, next. So the overall conclusion that we can make from this research paper that Diebetes Mellitus is an independent risk factor for the prognosis of COVID-19, which is this means that Diebetes Mellitus have a relationship towards prognosis of COVID-19. And these diabetic patients also should be intensely monitored during treatment, especially those who require insulin therapy. It is because from the previous slide, we can see that the survival rate for this insulin required diabetic patients is lower than non-insulin required. That's why this patient should be intensely monitored during treatment, especially insulin therapy. So lastly is the reference. This is the reference for this research paper, for this article, for this research study in APA style. Okay, I think that's all from me about this research paper, which is the relationship between diabetes mellitus and COVID-19 prognosis. Thank you, Dr. NORHASLINDA, and thank you for watching.